Paul and learn more about Good Sam. I guess we're recording too. My name is Maria Walden, and I am the development officer for the Community Foundation for Northeast Georgia, and I'm really excited to be here. We're here today to support Health and Hope and introducing Good Samaritan Health Centers of Gwinnett County. Um, the Community Foundation has partnered with them to help them in this mission. And we are so grateful to the leadership of Shameka Allen, who is the CEO. And without her leadership, we would not be able to do this sort of thing. And she has been so instrumental in advancing Good Samaritan on this mission. So without further ado, I'm going to turn this over to Shameka, but I am again so grateful for you guys all for contributing to and giving us your time today on Halloween. Happy Halloween, everybody.
Happy Halloween. Happy Halloween. I wore orange for the occasion. Uh, I knew we would be on a call today. I just want to echo what Maria mentioned. So my name is Shameka Allen, and I am the Executive Director slash CEO of Good Samaritan Health Centers of Gwinnett. And I am so pleased to present our clinic to you today. For those of you who are not unfamiliar with our mission and what we have done in the past, we are very, very happy to welcome you here. And for those who may know of our mission and have supported us, we welcome you here. I have been the CEO of Good Sam now since January. I took over from my predecessor, Greg Lane, who some of you may know. He is now our CFO and handles special projects for us. He sends his regards. He is not here today, but certainly all the work that has been done in Good Sam over the last 20 years here in Gwinnett County has been the culmination of work between a lot of different people. So I'm happy to give you an introduction to who we are and then answer any questions that you may have. So let's start with our next slide. Good Samaritan Health Centers of Gwinnett. We have two, soon to be three locations, and we have one mission. And if you look at our locations, the west location is actually what we call our main location. It was the first one that we built here in the downtown Norcross area. And it is a former office building that we used community HUD funds to revamp and refurbish. And so this is what we call our main office. And the pictures that you'll be seeing this morning are going to be from this location. And then we have our east location, which is located near Jimmy Carter and Rockbridge Road. We have a lot of exciting things getting ready to happen there, which I'll kind of explain to you during the course of this call. And then we are happy to announce that we have received certification to open Access Academy, which will be our third building, and it's going to house an allied health training school. And our goal for opening this location is going to be Q1 2025. So multiple locations, but some great things happening at all of them. Next slide. So I always like to give people an idea of our hours because, obviously if you know someone who is in need of our services, or if you yourself want to come by and have a tour, you can see that we pride ourselves on being very accessible. So our West Clinic, you can see we're open every day of the week and also the first Saturday of the month. And then the East Clinic has very similar hours, and we're only doing dental out of that clinic right now because we have a construction project that is about to start. So when you talk about healthcare access and people being able to get care when they need to for the uninsured, then this is one of those things that we like to say. We are a staff of 60 people. All of our staff is paid. So there's going to be consistency and continuity of care in whoever is served by our providers. Next slide. So I'll start out by giving you a little bit of a tour. So what you're going to see in these pictures is just a basic overview of what you'll find in our clinics. And our clinics look primarily the same. So this is the screening and prevention annex, and that's those two pictures on the left-hand side. And so this was made possible by a CDBG grant from HUD that It was approximately $650,000, and this is the construction project that we have happening at our east location. So this is the downtown Norcross location. We put this in 2021 as a result of COVID. You know, obviously many healthcare providers were seeing patients in the parking lot. We certainly were one of those. And after COVID, we all realized that we have to operate differently, right? We have to anticipate that infectious disease or patients who are sick or who are, even if it's flu and cold, they need to be isolated from the rest of the patient population and staff so that we can keep our community healthy. So this is what you will see when you first come into our buildings. And then on the right-hand side, that's the lobby for our west location. We believe in providing a dignified experience for our patients. So even though our patients most are low income or uninsured, we want to have this be a very welcoming environment. Our clinics are nice, bright, modern. We try to keep them very, very up to date on you know, the latest technology through supporters like yourselves and also through grants through other foundations. So we really pride ourselves on making this a welcoming environment, especially for those who may be new to the U.S. healthcare system. Next slide. And so one of the things that we offer at both of our clinics that kind of separates us from a lot of other places is that we have full service dental at both of our locations. So each location has 6 dental chairs. We employ 2 dentists, about 6 dental assistants, 2 dental hygienists, and we see thousands of patients each year. So we don't just provide acute care. We provide treatment plans. We want patients to be healthy and have good maintenance for their teeth because that affects their overall health. And again, I just want to point out very modern, new equipment. You know, we buy everything new, again, with supporters like yourselves and from foundations and grants. So, and then you will notice that all of our departments are kind of are a different color. And we do this because some of our patients do not read and write. So as we are directing patients throughout our clinics, there will be different colors. And so if we say go to orange, and as they're walking around the clinic, because our clinics are quite big, then they know that they're in the right place. Next slide. So we also offer laboratory services in both of our clinics. So you can get full lab workups. And really what I love about our laboratory services is we can do lab work for pennies on the dollar. We have a very, very strong partnership with LabCorp that allows us to offer patients the same type of panels and workups that you would get in a primary care, but at about 80% of the cost. So our patients can come in, they can stay healthy, they can get their lab work done. Whether or not they have an appointment or not, they can come in and get their labs. And we have 2 very, very highly trained phlebotomists who are both bilingual, who can help navigate this for our patients as well. And then on the right-hand side, we have the nurses station. So the gentleman in the middle is Dr. Goodson. He is our medical director. So we do operate on a what we call an advanced practice provider model. So excuse me, we have 1 medical director and 8 advanced practice providers, which is what the Georgia Medical Composite Board allows in terms of how many providers he can supervise. So he himself does also see patients. And we also are able to train students here, which is a big part of our mission, which we'll go into a little bit later in the presentation. So that is just a picture of our staff, and kind of on each side of that nurses station on the bottom right-hand side, that is where our exam rooms are located. We also have 2 procedure rooms where we can do advanced procedures. Sometimes we have specialty volunteers come in, maybe a GYN, a podiatrist. Sometimes we have a cardiologist come in, a neurologist. And those 2 procedure rooms are quite large, and we can kind of do special treatment in there when those volunteers are available. Next slide. Oh, I think we missed one. Yep. So great. We do have a picture of the procedure room. So that's just one example. And you'll see the podiatry chair on the right-hand side. And she comes in, I think, twice a month now to see patients who may be having issues with, diabetic foot ulcers, or just specialized treatment that we want to offer our patients at a very, very low cost. And again, providing access. And in terms of local and global impact, we love to show this. If you ever kind of come see our clinic in person at our West location, you will see that we have a global impact, right? So everywhere where there is a dot, and you can't see it as well on the right-hand side, but there are several of those on the right-hand side of the globe as well. That is where our patients hail from. So when they are new, we ask them to come in, we ask them to stick a pin where they are from, and we ask them to, tell us a little bit about their journey. So we're just pleased that we represent over 75 countries worldwide. We have people come in who are just visiting the US temporarily, or they have folks who are visiting them from their country temporarily, and we will see those patients. One of the things about our staff that I absolutely love is we are able to work on very little information. So most times when people come to our office, they come with no medical records, no history, and we start from the very beginning. And so I'm just in awe of our staff and how they are able to navigate that, because most of us who have insurance know that there is a long medical record that kind of follows us, right, wherever we go. And most of our patients don't have that. Many of them are 40 and 50 years old, and they've never been to a dentist. They've never been to a doctor, or we can't get a hold of their records from their previous country. So we do have to be very thorough and start from the beginning and provide great care. Next slide. Okay. And I just love to point this out. This is the inspiration for why we exist, I think. And I always love to share this with those who are learning about our organization. If you look at Luke 10:9, heal the sick who are there and tell them the kingdom of God has come near to you. And also Luke 10:34-37, he went to him and bandaged his wounds. Go and do likewise. So that is our inspiration from Good Sam. We consider ourselves to be the hands and feet of Christ. We are faith-based in our belief and accepting of all. So we have folks who come to our country who are, not faith-based, they just want treatment. But we do have some patients that want us to pray for them and want us to give them spiritual guidance and advice. And so for those patients, we do offer that connection. And we do hand out Bibles for those who want them. We offer biblical counseling, which we'll talk a little bit about here in a second. But this is the inspiration for why Good Sam exists, to do these two things. And specifically, when we look at partnerships and what we want to do for the community, we think about what the Bible says about the orphan, the widow, the foreigner, the prisoner, and our partnerships reflect that. Our partnerships in the community reflect that. So we try to keep our doors as open as possible, regardless of who you are and what you believe. Okay, so as we go into our mission, I hope those pictures kind of gave you a little bit of background and insight about our clinic and why we are so proud to show it off and give tours and have people come by, because we really do believe that that makes a difference in patients taking a part in their healthcare journey. So our mission, and if you look at our website, is to demonstrate the love of Christ through providing quality, affordable, and accessible health and dental services to uninsured and low-income families. That is why we exist. That is why we do what we do. You can see I have a picture of our West staff here. I think we took this earlier this year. We got a lot of ladies here, as you'll see from the pictures, but they are wonderful and they do a great job. Next slide. I do want to take a second to explain to you about our business model, because I do think this is very, very unique. And a lot of charitable clinics don't operate this way, but many are starting to see the benefit of operating this way. So we have a fee-based self-pay model. So, excuse me, I like to tell our patients or anyone who supports us that our services are not free, right? That's the first thing. We are very transparent with our costs. Our medical costs are probably about 50 to 60% of what you would pay in the marketplace, but they're not free. And we do that for a reason. We're very intentional about that because we do believe that people should be given a hand up and take an active part in their healthcare. So if you look at the total cost per patient, what it costs us, right? Because I mentioned to you, our staff is not volunteer. So it costs us $211 to take care of a patient. That's the average cost, right? If you look at medical and dental across all boards. The average patient pays $126 of that cost, right? So if you look at our fees and what we charge for our services, they pay the bulk of that cost. What is subsidized by our donors and grants is $85 of that. So a lot of people may say, well, Shameka, if you're charging, why do I need to give? Why do I need to support your organization? And that is because we do not pass the full cost on to the patient simply for the fact that we would price them out, right? They would not be able to afford our services. So we keep a very close eye on the market and trends in the market and try to make sure that we're charging the patient, what kind of fits in their ability to help pay. And the $85 is where we need help from our supporters to make care possible at Good Sam. And I know I'm moving very, very fast. So as we get to the end, I'm happy to answer any questions that you all have about anything I've said so far. Okay, so we do have three main goals here at Good Sam. And the first is to make healthcare accessible to the uninsured. So often the uninsured are ignored when it comes to healthcare. And I don't mean purposely, but I mean when you think about Medicare and Medicaid, there's still a significant number of people that don't qualify for that. Third-party healthcare is often unattainable for a lot of people. So I go to events all over the city with traditional healthcare providers, and I myself was in traditional healthcare before I came to Good Sam. And there is not a good plan for the uninsured, right? It's just kind of one of those subjects that we really just don't talk about. And I know Georgia has some things coming through the legislature that is meant to address this, but we still have a significant number of people that do not have healthcare insurance. So that is our goal, to make healthcare accessible to the uninsured, eliminate healthcare disparities, and help people get preventative care so that they don't get really, really sick. Also, reducing the strain on ERs. If you've ever been to the ER, if you have to go to the ER, the last thing you want is a long wait time at the ER. And we partner very, very closely with our friends at Northside because they refer a lot of patients to us who might not necessarily need ER care. Most uninsured patients go to the ER when they need care, right? That's the first place they're going to go. They're not going to go to urgent care. They're going to go to the ER. So our goal is to help decrease the demand for uninsured patients as they won't have to go to the ER. And most people don't know that one of the main reasons people go to the ER is for a toothache, right? And the only thing they're going to give you at the ER if you have a toothache is an antibiotic, and they're going to tell you to go see a dentist. So we are trying to help ease that burden and strain on emergency services. And I mentioned earlier that we love to train. So we are one of the largest trainers for primary care providers in Gwinnett and probably in the state. We work with probably about 5 healthcare center, advanced colleges: Mercer, PCOM, University of Georgia, University of North Georgia, Emory, you name it. We probably had a student from there. And these are nurse practitioners and physician assistant students. So these are master's level healthcare providers who need primary care rotations. And a lot of places just will not let students in anymore. Like it takes a lot of work. We tell all of our staff that if you want to work here as a provider, you have to be willing to train. And I'm proud to say that every one of my providers were students here at one time, right? So it really does make a difference. We have seen folks leave our doors and go on, start as medical assistants and become physician assistants. So that training and that mentorship is very important. And that's one of the things that I think we do well. We've been doing it for over a decade now. Next slide. And I'm going to take a sip of water, guys. I've been talking a lot and okay. All right, so our goals and how they impact the community. I mentioned that our clinics are open 5 days per week, including weekends and evenings. So that's how we make our impact, right? We save approximately 2,500 to 3,000 monthly ER visits reduced because they are coming to us instead of the ER. And if you look at the math, we have spent approximately $300,000 in training hours on future licensed providers. So the implications of what we do don't just affect us here in the clinic, but they have a local impact, a state impact, and the amount of investment that we're putting back into Gwinnett and the surrounding metro areas.
That's how you can get some numbers, yeah.
Okay, next slide. Next slide. Okay. And then for those of you who may be on the call who remember how it started, the original Good Sam opened back up in 2005. I mean, it was small. It was 4,300 square feet. It was an older building, and we were only able to see about 200 appointments per month. And there were sliding scale fees and payment plans. So this is a real photo of folks who were waiting in line to be seen back in 2005, hoping that they could get a spot before we closed for the evening. Next slide. Now, more than 10 years later, we have the Beaufort Highway location that's opened, and it was a new business model. So this was when Greg came in, and it started as a part-time clinic. And if you just look at the numbers, I mean, we went from 4,000 visits in 2010, 3,200 visits in 2011, 5,900 in 2012, 10,000 plus visits in 2013, up to as high as 35,000 visits in 2019, and on track to do about 30,000 visits this year. So again, the numbers have just been extraordinary in the number of people that we have been able to help over the years and continue to try to help through the support of our community and folks such as yourselves who support our mission. And next slide. And so this is the West Clinic that I mentioned. We are off of Beaufort Highway, 17,000 visits in 2015. And this is all about offering that dignified patient experience that I mentioned earlier, having people come into a facility that's nice and clean, right? That if you look at our Google reviews, this is one of the main pieces of feedback that we get. I kid you not, the place was so clean. And sometimes people who are low income or who have struggled or who are in poverty do not expect that. They expect for their services to not be as good as someone else's. And we don't buy into that. We feel like everyone deserves the right to a dignified experience when they go see their provider, no matter who you are. Next slide. And I mentioned the East Clinic expansion. So this has been funded through CDBG funds. Again, we are so grateful to partner with HUD and with the county officials who make it possible for us to do these expansions that actually keep our mortgages free, right? So if you think about it, we own these buildings outright, and that allows us to keep our costs low. It allows us to be very entrepreneurial in spirit and be able to react to what is happening in our communities. CDBG, thank you for asking. That's Community Development Block Grant. So this is funding that HUD provides to some counties in Georgia that qualify for it based on certain demographics. And every year HUD gives a certain amount of money to Gwinnett County, and you have to apply for that funding, and you have to show that you're going to use it towards a betterment of the community. So we have been blessed in that we have received over the course of 10 years, nearly $7 million in HUD funding. So it has allowed us to purchase those two buildings, the two buildings that we have now, and also help us prepare for purchasing Access Academy, which is going to be our school, a third building. So this has been such a great partnership. We've had officials from HUD, from DC, come to our clinics just to kind of see, what the dollars are doing. So, and again, this is a special care center for patients with communicable diseases, infectious diseases. We see folks who are newly arrived. And so we do see a lot of things that, such as tuberculosis, things that we still see in some third world locations that we have to manage in our clinics. So this is, again, going to help us keep our community safe. And this is just a quick overview of our services. So you can see primary care, specialty care, chronic care management. Many of our patients suffer from diabetes, hypertension, high cholesterol. So we work at the very, very top of our scope, right? We know when we refer patients out, the likelihood of them going is low because of money. So all of our providers are trained to do that. You see our dental services. That's our dental team there at the bottom right. And we also have someone certified to do biblical counseling. So she is working on the spiritual component. If we have patients who want to know more about the word or who just want to just learn more about that, then she can work with them on that as well. Next slide. And then on the horizon, we have Access Academy that is coming. We want to focus on preventative care for the uninsured. We want to focus on community healthcare education and offering wider access to dental care. Dental is one of those fields that a lot of nonprofits are not participating in right now because it's very expensive and the learning curve is very steep. So we want to continue to just be that resource for the county. Next slide. And of course, just like every other nonprofit, we are in the midst of our end of the year campaign. And so we are looking to raise $600,000. And as you can see, we have already, just from supporters like yourselves, from grants, we have raised 1.07 million of that, and we're looking for another $600,000. So our budget is a total of 1.6 million for development. And again, for our total budget, patients pay the majority of that. So we've always prided ourselves on being self-sustainable, right? We try to be as self-sustaining as we can. But again, with the deficit that we see with costs versus what we give to our patients, we are not always able to do that, right? So that's where we look for support from the community to be able to help us do what we do. And we kicked off this campaign in October 1 of this year. So still in the early stages, and excited that it's going on right now. Next slide. And ways that you can support our mission. We're happy to say that we are partnering with Community Foundation. And one of the reasons why is, as our business becomes complex, more and more complex, we wanted a more sophisticated way to connect with our donor community. And so we knew by partnering with the Community Foundation that it would allow us to just interact with our donors and our supporters in many different ways. The Community Foundation has a wonderful reputation for just being that connection and having a group of like-minded people who believe in serving and who believe in the services that we offer. So we're so excited to partner with them this year. If you are a fund holder, or if you would like to donate to us, we are fund holders as well. You can certainly donate through that. We are always looking for people who want to serve with us as volunteers. And also, if you like to give things, this is just a little bit of our wish list. Some of the things that other organizations have done for us in the past that we have passed on to our patients. So everything that we do is just rooted in patient care and rooted in giving patients the opportunity to have the best experience possible. And Greg, I'm going to give you a moment. Do you want to speak more on the Greg Johnson, more on our end of year campaign?
Hey, yes. Hey, good afternoon. Actually, good morning, everybody. My name is Greg Johnson. I am the Director of Development for Good Samaritan Health Centers. I've had the pleasure of meeting some of you and those who are on the call. Thank you for joining us. You can see a lot of great things are happening in our community through the Good Sam Gwinnett, and we can't do this, as Shameka was saying, without your support. So I'll just say this real quick. Yes, we do have our year-end campaign going on currently right now. We do have a generous donor who is challenging new supporters and current supporters that for every dollar given between now and November 15th, it will be matched up to $50,000. So if a great opportunity, if you like, if you like to have something matched, your dollar is expanded even further, this is a great opportunity to do that. So, and there's multiple ways to give, as is showing on the screen. And I know Shameka will talk a little bit about our partnership with Community Foundation. And then you can also give online on goodsamgwinnett.org/donate. Thanks, everybody. Thanks, Shameka.
Thank you. And I believe that's, oh, yep, my information. So if you would like to get in touch with me further, here is my contact information. You can certainly call, reach me by email. I'm also on LinkedIn. We love to give tours, as I mentioned. If you've heard something here that has piqued your curiosity and you want to learn more, or you want to see what we do in person, feel free to reach out to myself or even Greg Johnson to see if we can schedule you to come in and meet our staff and learn more about what we do.
Well, thank you, Shameka. This is Maria again. And anyone that also, or if you have questions and want to reach out to me as well, I think, you can reach me at mwalden@cfneg.org. But Shameka is a great resource, and we're so excited to be a part of this. And what you're doing for the community is just tremendous. So thank you so much for making time, Shameka, to share your mission and with your leadership. This is just, I know it's going to be a complete success. So thank you. And Greg, always a pleasure. Thank you for all your hard work. And yeah, if anybody has any other questions, feel free to include that right now.
All right, so we have our chat feature, and you can also unmute yourself if you have a question. So feel free to do that. I did get some questions ready, Shameka, while we're waiting on our audience questions.
Okay.
So what are the biggest challenges Good Samaritan Health Centers of Gwinnett faces in providing care to the uninsured?
I think the answer to that is just with funding. Obviously our patients are very, very affected by the economy. And so when they are, when things are not going well for them, they are unable to make their appointments, right? And so for them, the need for support, I think, is very, very great. Majority of our patients, 51% of our patients are at or below the poverty level. Right. So they are heavily impacted when things take a downturn. So we offer Good Sam Fund dollars and Good Sam Lab bucks and things of that nature to try to help our patients. But those funds have been depleted. I mean, we've had so many patients request that assistance. So we are still offering that assistance to patients because that is what we do. That is what Grace is. But the need for ancillary services such as that is still there. And I think for our patients, it's a big challenge because they are so heavily affected by economic downturns and inflation and all the other challenges that we've seen throughout the year.
Hey, thank you. I know that you shared some about the new initiative, about the new academy. Can you tell us a little bit more about how that got started and how we got to where we are today?
Yeah, absolutely. So Access Academy was kind of the brainchild of my predecessor, Greg, and I, and we were we are the home. We do a lot of externship opportunities for students. And so we get contacted all the time by schools saying, hey, can we send students there to extern? And these are not college students. These are folks who are in typically allied health programs. And so we just were not very satisfied with the quality that we were seeing, the amount of skill, the work ethic. And we were trying to think about, what do we want to do for our third location? And we just kind of looked at each other and said, why don't we open up a school? Because we have a strong history of training volunteers that become medical assistants that go on into other healthcare professionals. And a couple of years ago, we've had 7 students leave us to go into PA positions and nursing positions that, because of our training and mentorship, they have been able to be successful. And these are first generation students here. So we thought we wanted to formalize this and really put the Good Sam stamp on it and offer that same opportunity to low-income students who may be looking for a leg up. And this will allow them to receive training in a field that is heavily, heavily understaffed. Heavily. No matter how many MA programs we have out there, there can never be enough. And I can tell you this as a healthcare provider. So this is our way of really giving back and offering people who might not otherwise have an opportunity to learn the healthcare field that will hopefully be a stepping stone to other healthcare careers. And so we just wanted to kind of leverage that expertise and really build it into something formal that will be around for years to come.
All right, great. So I'm checking again if our audience has any questions. I don't see anything in our chat box. And I'm going to return back to these slides. So anyone who wants to get in touch with Good Sam, with Shameka, you can contact her in these different ways. And this also will be recorded as well.
Yeah.
So any final thoughts? Mm-hmm.
Yeah, I just wanted to, again, just thank everybody for their time. I know, as the holidays are arising, I'm so grateful we could get this on the calendar and present this as a brief introduction of Good Sam and what we do. And it's hard to put into, a webinar, all the things that we feel like we bring to the community. So I'm grateful for your time, and I'm hoping to give you some time back on your busy Thursday. So yeah, we're here if you want to come tour, if you want to come learn more about it, and also to answer any questions that you may have. So I just thank you for coming.
All right. Thank you, Shameka. Thank you, Greg. Thank you, everyone, for attending today. We appreciate your time and your support. Have a great day, everyone.
Thank you.
Bye.
Bye.
Thanks. Bye-bye.